Hey y'all, welcome back to the channel, The Nursing Chronicles with Monique. I am Monique. Thank you so much for joining me. Please remember to like and subscribe if you haven't already, and ring that little bell so you can be notified of my next uploads and podcasts. So today, guys, I'm going to do another COVID-19 update, aka coronavirus. This is important for my healthcare workers and their families. This is something that has to be done because some of the stuff that I'm seeing is just so disturbing to me that I'm going to go ahead on and get started. So this is The Guardian Live. I will put all links below to where I'm getting this information. I do like The Guardian because they give more up-to-date information. So a ninth person with coronavirus dies in Washington State as New York sees a second case. So we have two people in New York. I think it's an attorney in his 50s from Westchester County. And then there's another young lady, I think she's 38 or 39, living in Manhattan. I think the young lady traveled to another country, and I'm not sure about the other person. So here, this is from The Guardian. I'm just, it's The Guardian online, so I'm going to show you where I get this from. And let's see what's going on here. There's been a surge in cases, as we all know, especially in Washington State, and there's a nursing home there where there have been multiple residents who are elderly who have been exposed to this coronavirus, and unfortunately 9 people have succumbed to this fast-moving this disease. And let's see what happens here. Let's see. One of the things I did see Governor Cuomo. I'm a New Yorker. I used to live in New York, born and raised. And one of the things I did see, he's being proactive about passing certain laws and bills. This is not a supporting thing of him, but it's encouraging to see some states are taking things into their hands and passing certain bills. Like one bill that he passed was that healthcare workers or whomever who have to be quarantined for 14 days, he's putting it into that state's leave act that they should be able to get paid. New York State has a leave law. I think it's Oregon, Jersey. I can't remember what other state. California. Their states have a leave policy, which all states should have. And I'm hoping that all states will adopt the same thing for nurses, that if we are exposed to this particular virus and have to be quarantined, that we will still get paid and that it won't come out of our vacation or our sick time. But those are stories for other days. Let's see. What is New York else saying? News of the second case spread as an Orthodox Jewish school in New York City canceled classes on Tuesday. So they are really trying to, it says a 39-year-old woman recently returned from visiting Iran, one of the virus's global epicenters. So one of the women it went to Iran, and she came down with the coronavirus. Her husband is also undergoing testing. So that's where we are now. But let me show you why I really wanted to do this video. Now, this is, I'm thinking, if I can remember correctly, a picture of them evacuating a patient from a nursing home, if I'm not mistaken. And you can see this man has this emergency worker or healthcare worker has a mask on. It looks like he has glasses, gloves, and a apron on, right? So, but I'm going to show you something, and I'm going to show you something. I don't know why that's in the way there. I'm going to show you something, and let's see if we can bring this up. So you see this picture here. This is a picture of healthcare workers, how they're gowned. Now take a close look at this. This is a picture of healthcare workers. I'm not sure what state, but it's not here in the U.S. I think this is either Italy or South Korea. But you look very closely how they are, their PPE, their protective equipment that they're wearing. It looks like they have on a whole full white jumpsuit, then yet another apron in front, and I think I know why they did that, so they don't contaminate themselves when they're taking it off. They have full headgear from head to toe. They are gloved past their aprons. They have goggles on, plus face masks, so there's no mucous membranes being exposed. Do you see this? Now, look at this picture here. This is a picture. This is from Global News, but this is that nursing home in Washington State where they're evacuating this patient. But look at how they are dressed. And look at how compromised they are. Their backs are compromised, so their backs are contaminated. They went into a contaminated nursing home, right? And they went into this contaminated nursing home, so all of their backs are exposed. So everything on them in their back, everything is exposed. Everything is contaminated. Their shoes, their pants, everything, even her hair. That's why this picture, everything is covered, because everything is contaminated. And from what I understand, even in China, they were shaving their hair off and their beards because it's a vector. It can hold the virus, right? So now look back at this picture. He don't have nothing on his head. I'm not sure if he even has a mask on. He has no gown on. I mean, all of these people should go and be quarantined for 24 to 30 days because they clearly are going to contaminate anything that they touch, including the vehicle that they're putting this person in. So can you guys see how this thing is spreading and why this is a picture here? And even in China, they are covered completely. Every orifice, every mucous membrane, eyes, nose, mouth, ears. So they have goggles on, mask on, hoods over their hair. They're gloved. So what happens is when they take this outer apron off, that's contaminated. Then what they will probably do is after they take their gloves off, put on another set of gloves and then take this off, their jumpsuit.
And can be linked back to.
So this is a situation where I really do feel like they are not protecting, healthcare workers are not fully being protected or not protecting themselves, or they're not aware that this is what's going on in other countries. This is how they're protecting themselves in other countries, guys. And this is what we're doing here. So there's a situation where I don't know if I think I have another upload where in Chicago, a patient came back from overseas, went to Chicago, had some flu-like symptoms, went to the hospital, and come to find out she was positive for the coronavirus. But 60 employees, guys, 60 healthcare workers had to be quarantined. If we do not protect our healthcare workers, you're going to find that there's not going to be anybody on the front line to take care of people who are sick, because you're talking about 60 people. You're talking about shifts. There's a shortage of nurses and healthcare workers anyway. And you can't bring somebody up to speed like that, just like that. There's no hair covering. There's no bonnet. Everything on her back is exposed and contaminated. This man right here, everything is contaminated on him. He's so busy trying to cover up a face from HIPAA. Who really cares about that at this point? Like, dude, you protect yourself. So guys, ladies and gentlemen, if you guys are out there, EMTs, healthcare workers, even the firemen, if you got to go to a place and they're saying there's somebody who has potential shortness of breath, if you're not in a spacesuit like this, that's how you're supposed to look when you're going to take care of one of these patients or going to retrieve them. They should be providing y'all with gowns, those Tyvek suits that have the hood on, goggles, mask, booties, all of that, and an apron. So there's no skin exposed, it looks like, period on these people. You could barely see, no skin is exposed, hair, nothing. Look at this. Look at this foolishness right here. So all of those people are probably out on quarantine. This is careless. This is haphazard. Look, if you guys are going in and they're not giving you the proper PPE, then you can't do your job. There's no way for you to be able to do your job. This is reckless. This is careless. This makes absolutely no sense whatsoever. I'm sorry about that, guys. But can you see the difference in these two pictures? They're taking care of a patient in the hospital, but this patient, you have to treat anybody like they have the actual illness. If you looked at some videos back from China, they came out like they were going to space with everything covered. Every mucous membrane and orifice should be covered. I'm not understanding what the heck is going on here. Nurses, if they're not giving you gloves and masks and different things, call the superiors in the hospital. I would not risk my life doing this if I didn't have the proper equipment to take care of my patients and to protect myself. This is ridiculous. This is absolutely ridiculous. This is something that I'm just like, really? So there's 60 positive or presumed positive cases nationwide. Okay, these people are not protected either. Look at this. Look at this. Look, everything is exposed here. Everything. I'm just, this is really disturbing to me. And, nurses, take your life into your own hands and ask for the equipment that you need and treat each patient. My thing is, if you know for a fact that this particular illness is spread this way, and they weren't even, you had to meet a criteria of being damn near critical before they would test you. Are you wanting this to spread more? Because that could be the only reason why I would think you wouldn't test people. This is ridiculous. I don't know. This is why I kept on saying months, and I don't want to rub it in, about nursing is all wonderful, but all of these nurses on these channels talking about, oh, nursing this. Yes, it is. But who is on the front lines of this, ladies and gentlemen? The majority of the healthcare workers are nurses. The nurses are the one on the front line. These doctors, I'm not saying they don't take care of patients, but the ones who's doing the direct patient care are nurses, not these doctors. This is ridiculous. This is a hazard. It is disgusting. And this is one of the reasons why I seen this coming, not this coronavirus, but I saw the way a healthcare system was going. And it's like they didn't even give a crap about us nurses. And that's why I kept saying, guys, start a business, try to find a way so you don't have to be reliant on this situation. And look at what they're getting ready to throw nurses into. Not telling the truth, lying, not being truthful and honest, telling people that they don't need to wear a mask. So why all of these people right here gowned up and gloved up like they getting ready to go to space? You tell me why. That was one of the most irresponsible things that anybody could ever say, is we don't need to be going out and buying masks. Then why are these people masked up? Tell me why. Can you really tell me why these people are masked, gowned, gloved, goggled, footies, booties, and everything up in a hospital taking care of a patient with coronavirus? That's ridiculous. That was irresponsible, and it was wrong, and it's giving people a false sense of security. And it's putting not only the nurses at risk, but it's putting other people's lives at risk by telling people they shouldn't wear masks. They should try to wear something, do something to protect themselves. This is it. Boy, let me tell y'all something. This is what you call a hot ghetto mess. People who don't know. But you know what? It ain't that they don't know. They know exactly what they're doing. They know exactly what they are doing. Let me tell you something. A lot of these things, man, y'all don't understand. I don't even want to get into that on my channel. But nurses, the point of me saying this is I want to show you the difference. Protect yourself. If you go to your departments and ask for goggles, Ask for face masks. Ask for those Tyvek suits, those whole suits where you can put, with booties on, all of that. Hair nets, all of that stuff to cover yourself. Nothing should be out. There's no mucous membrane should be out. Because this is total irresponsibility. But there's no way these people they know exactly what they're doing. Because here comes the I think Trump met with the heads of the vaccine for them to create a vaccine, but they said it will be a year off or so. I ain't gonna say nothing about that. If y'all ain't woke and y'all don't understand what's going on here, I can't help y'all. But y'all need to wake up and understand that you have to help yourself. These people are not going to help you. They're going to tell you all type of innuendos. They're going to say all type of stuff. And it's not even going to be near the truth of what really is going on. They burning bodies in China left and right. Man, y'all don't understand. Those of you who are believers like myself, we know what's going on. We need to pray, humble ourselves, and pray and fast. That's what we need to be doing. Praying to the Most High and fasting. And those who are not believers, that's fine. That's perfectly okay. The other thing, nurses, boost your immune system. Boost your immune system. Taking your D3, vitamin C, zinc. Getting those supplements in your body to help boost your immune system. So if you do get exposed to this, you'll have something there to fight with. But I just wanted to show you the whole difference in how these healthcare workers in this picture are totally protecting every orifice of their body. But yet everybody that I see on TV in the US, healthcare workers are totally almost exposed. Now, I don't know what's going on. This is just a snapshot of one situation, but EMTs, guys, you got to protect yourself. Firefighters, when you're going out, protect yourself. You got to go back home to your family. Police officers, protect yourself. You got to get back home to your family safely. All first responders, protect yourself. If they're not giving you the PPE, you can't do your job. Because not only are you exposing yourself, your family, but you're exposing potentially your other coworkers and other patients who may not have it. So they need to get with it and give you guys the PPE. Y'all should be riding. Get in your car. Look, every hospital should be shipping some PPE equipment or have a drop off before y'all go into work to have some PPE equipment. Firefighters and EMTs, police officers, your organization should be giving you guys some PPE equipment. Y'all should be riding around in your cars and your trucks with these things. So if you have a call and it's a patient, y'all have some PPE to put on. This don't make no kind of sense. Nurses, protect yourselves. Go, and if you can't get any, they should be providing you guys with N95 masks. But if you for your own sake, see if you can purchase some. I don't know if there are any place where you can get them at this point. But I've been talking about this for well over a month. And now it's here. But they slow walk this. I think they're still letting flights come from South Korea. Why? It's like you want this to intentionally spread. Why? If you knew this was happening, shut down the flights that are coming from these places. It don't make no sense. And then the other thing that was asinine in Texas, they had a young lady who they quarantined for 14 days. They did the test, but they let her go before all the tests came back. Mind you, she goes into a mall. She goes into Macy's. She goes to the food court. She goes shopping. I don't blame her because she was on 14 days quarantine. So she probably was happy to get out of there. But all her tests had not come back. They came back positive, and then they had to put her back on quarantine. Who are the fools? It's like like this is intentional. I can't even call this incompetence. If myself as a nurse gives somebody the wrong medication 3, 4, 5 times, I have to think that this person is totally incompetent or they're doing this stuff purposely. This doesn't make any sense to me. I don't understand what's happening here. But to me, that just should not happen. How do you test somebody, not wait for all the test results to come out and let them go on out of quarantine to go out into the public and expose more people? Are you guys serious? I could run the show better than what they're doing. Are you serious? I know I could run it and make it happen. Just use common sense and critical thinking skills. But anyway, guys, police officers, like I said, if I were in charge, the PPE, y'all would need. First of all, they knew about this. They knew it was coming. So they should have had these masks on back order, being prepared over a month ago. PPE equipment in every firefighter's fire station. PPE equipment in every police officer's, car, whatever. PPE equipment in every EMT cars, ambulance. They should have been there. All of this stuff should have been there. Man, we knew. I've been sitting and watching this since January, the beginning of January. And we've all been watching this on the news. And so you're going to tell me we slow walked it to the point. Now we're going to start acting once it's here and be reactive when we had more than ample enough time. Nurses, protect yourself, yo. For real, for real. This ain't no joke. Like, this is, every man has to protect themselves at this point because ain't nobody looking out for you. This is all the stuff that I said. Go back to my other videos. This is this exact situation that I hate to have to say, I told you so. This because they don't give a crap about us. And we're the largest part of the healthcare team. And we're mothers. The average age of a nurse is 50. Come on. We don't have any, cushion here. They know who the healthcare team is. And if a bunch of nurses get sick, who's going to take care of these patients? Man, this is a hot mess. I'm just ranting. I'm going on a rant right now. But seriously, this is just ridiculous. Absolutely ridiculous. It's irresponsible. And so you're supposed to risk your life for what? If they don't have the PPE, if I was a nurse, I wouldn't be going to work. Yo, if y'all can't provide me with what I need to take care of these patients, guess what? Fire me. Fine. I wouldn't even care. Like, why? Why would I go and risk my life, guys? And they're saying, oh, well, only elderly patients are at risk. No, not necessarily. Because over in China, I don't know if you guys have not been paying attention, many doctors and nurses have died, and they were not, some of them were relatively healthy, but from the stress of constantly taking care of these patients and putting these PPE on and being exposed, some of those nurses and doctors passed away. A lot of the nurses and doctors got infected. So that is the truth. If they're not giving you the PPE, you're going to have to wait until they deliver something to you. You can't take care of patients without the proper equipment. Call your superior, call a hospital administrator, do whatever you want. But if they didn't give me the proper equipment to go in and take care of patients, I'd be like, I can't accept that assignment. We don't have the proper equipment. Let them go in there and take care of the patients. But this is not a situation where, hopefully these hospitals are on point. Hopefully, I'm hoping and praying that they are. But if they don't have the proper equipment, mask and different things, then you can't take care of the patients. You're going to have to speak up. Worry about your job another time, but you can't get your life back. Not, you got kids, a husband, or whatever. But this is a situation where I'm just like, I'm looking at these pictures. I'm like, well, why are we here in the United States not doing the same thing? I mean, they look like they are double gloved. Literally, these people are, every orifice is covered. They're not even letting it touch their skin, looks like. I think only thing that's open, I think, is just this slit for their eyes, but their eyes are covered with the goggles. Man, look, nurses, take care of yourself, boost your immune system. I'll leave the link for my website so y'all can order you guys some good supplements, your D3 with K2, your elderberry, order your vitamin C, order your stuff, hot doses of garlic, onion. Those are really good immune boosters. Echinacea. My grandmother used to do a golden seal at one point in time. But these are things that I do. But you do need to make sure you boost your immune system and eat right, get enough sleep. But this is very stressful, guys. This is the type of stress that will cause your body to shut down, and stress depletes your immune system. I'm concerned about my nurses. I'm concerned about my nurses, and I'm concerned about all healthcare workers, all first responders, my police officers, my firefighters, my EMTs. I'm concerned about all of y'all. Your techs, protect yourself, yo. They don't have the equipment for you guys, then tell them you can't go into those patients' room until you have the proper equipment. I don't think you should. I mean, that's going to expose other people. So I'm hoping that the hospitals have the equipment that y'all need. But it looks to me like these other hospitals and healthcare facilities are basically using, the PPE, where they are covered. All skin is covered. Every mucous membrane is covered. And I think that's how it should be. I think that's the protocol in China as well, too. South Korea and in Italy. That's how you prevent yourself from being infected, guys. Right? That's how you prevent yourself from being infected. But if you guys know anybody at a hospital, and let me know what the hospitals are doing, what kind of meetings they've had to keep you guys up to date and to prepare you guys for this particular situation. But it does make me very nervous to see the difference in how different countries, how they're handling this. And if we're not careful, if somebody in your family or loved one gets sick and really needs critical care, there may not be a healthcare worker to take care of them, guys. If we do not protect if we don't protect our first responders, I just don't know. Is it going to be mass chaos? I really, really don't know. But at this point, I really don't know, guys. I know this is a rant, but sometimes you got to do a rant on YouTube and then the next day you're able to get it together. But I don't like what I'm seeing. And I know what this means. It's like in my heart, in my gut, in my soul. I know exactly what this means. Utter confusion, utter disarray in a hospital setting. That's what I see happening. The hospital's turning people away. If you're not damn near dead, they probably won't see you. Let me see. Hold on for a second. Let me play this clip here. And hopefully y'all will be able to hear it. Let's see. Let me play this clip here. This is from CBS Morning News. And I'm going to play it. Let me turn up this volume. Make sure my volume is up. And let me just play it for you now.
Especially concerned today about a cluster of infections at a nursing home in Kirkland. That's a suburb of Seattle, and it's where we find Jonathan Vigliotti. Jonathan, good morning. What are you hearing about conditions there in the nursing home?
And good Good morning to you, Tony. First, I just want to point out, you see an ambulance leaving here. They arrived here a short while ago, taking one patient to the hospital for testing. Listen, we've been speaking with family members who have loved ones inside who are in isolation, many of them showing all of the symptoms and yet not being taken to the hospital for testing. State health officials say they simply do not have all of the options available to them right now as their resources are stretched, and they say they have to wait until cases like this one we just saw turn critical.
What?
The coronavirus outbreak at a Washington state nursing home is pushing officials to intensify their response to contain the disease.
We expect the number of cases will continue to increase in the coming days and weeks.
Here in King County, officials are planning to buy a motel and set up modular units to house coronavirus patients requiring isolation. They are most concerned about the elderly, like those at the Life Care Center nursing home.
I'm anxious, very anxious.
Carmen Gray's mother, Susan Haley, is under quarantine at the facility.
You asked for your mother to be tested for coronavirus. What did they tell you?
That she did not meet the criteria at this time. They're being held hostage in a petri dish.
In San Antonio, Texas, the mayor is declaring a public health emergency after a woman who tested positive for coronavirus was initially cleared and then visited this mall before all of her results came back.
As mayor of this city, I find it totally unacceptable that CDC would release a patient prior to receiving all test results and potentially expose the public to this harm.
The city also filed a temporary restraining order against the government to keep more than 120 passengers from the Diamond Princess cruise ship quarantined longer than the 2 weeks required. More than 700 people on board were infected with the virus. Monday, President Trump met with
Okay, guys, I'm not even going on. Did you see what he just said at the beginning? He said that they are so stretched and so short-staffed, they do not have the resources to those patients that are in that nursing home, that they do not have the resources to, they're so stretched that they have to wait until the patient is critical before they transfer the patient out. Are you serious? It just started. This whole situation just got underway, and they're basically saying it's stretched. The healthcare system is stretched. Because can you think of how many people it takes to take care of one coronavirus patient? It needs to be 1-to-1, because you got a gown, glove, take care of the patient, go out the room, detect. I mean, it's probably, oh my gosh. And then you just heard the patient who they let go without all the tests coming back. This is the CDC, guys. The Centers for Disease Control. The people who are supposed to know all about this public health crisis and how to prevent it. They didn't even wait for her test to come back. They just let her out. You know what? This is why I'm going on a rant. I can't make this stuff up. That's why I kept reporting to you guys the state of what healthcare looks like. People just don't care. Anyway, I'm going to go. Protect yourselves, guys, okay? Just protect yourselves. And I will see you on the next upload of the Nursing Chronicles with Monique. Peace, guys.